Good morning. Thank you very much, Karima, for that very kind introduction. It's wonderful to be here among you. I also have been looking forward to this day for some time. I must say, Minister Boudreau, I'm not sure that I'm going to be able to follow your fantastic announcement, but you've definitely set the bar for next time I appear in front of the Canadian Nurses Association. I'm going to have to come bearing more gifts. It's terrific to be here among so many honored guests, and I thank you all for your presence and for your very kind invitation. Particularly lovely to see some of my fellow parliamentarians, Wayne Long and Elena Lockhart, who are here, and so happy to be on their home in their home province, and happy to see lots of folks here, and particularly to enjoy the summer solstice, longest day of the year, to spend that day in New Brunswick. How good is that? And National Aboriginal Day, all of us celebrating here in St. John. We're off to a good start and an early start. You know, over the years I've had the privilege of working with so many excellent healthcare professionals, both here in Canada and abroad, but every stage and every season of my career, there are nurses who have been a part of it. And as I think back on them, nurses that I worked with in Niger and Ethiopia and in many places across Canada, nothing that I have done would be the same without the fantastic nursing colleagues that I have had along the way. I've been so struck by the dedication, the professionalism, the resilience, the creativity of the nurses that I've worked with. And I want to thank Minister Boudreau not only for your excellent announcement, but for your focus on primary care. And I really, really think that's going to set New Brunswick apart and hopefully be a challenge for the other provinces and territories to continue to focus on primary care. And the conference this year, I gather, is focused as well on expanding primary health care and primary care nursing. And so I want to give a particular shout out when I think about all of the nurses in my life who have meant so much to me. I wanted to particularly dedicate my comments this morning to Brenda and Jan and Sarah, who are the three primary care nurses that I worked with in the family health team in Markham-Stouffville. And one of the best experiences of my life was being able to develop a fantastic interprofessional primary care team at the local hospital where I worked. And Brenda and Jan and Sarah are really the heart blood of that place, and probably right now are getting themselves ready for another busy day. So I want to express my gratitude to all nurses for your commitment to excellence in patient care. And it's one of the reasons why Canada does have a strong healthcare system, and one that we can be proud of. I wanted to talk today particularly about a few areas where I believe that nurses have particularly transformed our healthcare system to provide better care for Canadians. And I also want to touch on a few areas where I think we can do even better, where we can work together to improve our common goal of building a stronger, healthier, adaptable system that's grounded in the principles that we value so much, including universality and accessibility. I look back on some of the things I've been able to do even as Minister of Health, and I think about one of the highlights being the day that I got to attend the Indigenous Nursing Awards of Excellence ceremony in Ottawa in May. And I had the privilege of recognizing some of the outstanding nurses who have provided healthcare services over the years to Indigenous communities across Canada. It's been more than a century now that nurses have been providing healthcare service in rural and remote Indigenous communities. And you know, we often hear and talk a lot about the challenges in those communities and the huge and unacceptable health gaps, but there are so many good news stories, and that's what I heard that day, particularly the stories of outstanding quality care and community resilience. I had the pleasure of attending the First Nations Inuit Health Branch's 2016 Nursing Awards of Excellence, and there were so many inspiring stories that I wish I could tell you about all of them. But I wanted to tell you about one person in particular who won an award that day. Perhaps some of you even know this woman. Her name is Joyce Ball. And she worked for 24 years, I think is still working at the Stoney First Nation Health Services. She provided primary care nursing, became a Canadian diabetes educator, and spearheaded a community wellness program with an emphasis on addressing ways to decrease the effects of diabetes. She developed diabetes management clinics, foot clinics, walking groups. She organized and ran a summer camp for kids. She eventually earned the nickname Wa Minuska from her First Nations colleagues, which in the Stoney dialect apparently means busy ant. And I suspect there may be some other busy ants in the room here today. But it was a fantastic program and really made me realize the incredible contribution that nurses can have and will make in Indigenous communities across this country, playing a pivotal role to expanding health and wellness, particularly in the most rural and remote communities of Canada. Not only providing care, but also, I think, being mentors and helping to inspire a new generation of care providers, some of whom have grown up and been nurtured in the North, and others who have moved there to serve their own communities. Some of you may be familiar with the First Nations Medicine Wheel, which I think is a great demonstration of how wellness means keeping people well physically, mentally, emotionally, and spiritually. And it affirms how much of our wellness is rooted in a sense of belonging and purpose, which is so essential to wellness. As you may know, disparities in health outcomes have deep roots in so many long-standing social inequities, and the solutions to these gaps are complex and must be comprehensive. And this includes many things such as the value of traditional healing practices and cultural safety, many of those that have been highlighted through the Truth and Reconciliation Commission. Here I want to acknowledge the solutions that you, through the Canadian Nurses Association, have proposed to improve health care for Indigenous peoples. Recently, I understand that you have partnered with ANAC, which is now known as the Canadian Indigenous Nurses Association, or CNA, and have generated some fascinating ideas and important findings through that work. I've spoken to Indigenous leaders in the country who are equally committed to finding those real and lasting solutions for health gaps in their communities. And quite frankly, I think that those solutions are very much within reach as organizations like the CNA and the CINA are on board to help. So today, as we celebrate National Aboriginal Day, I want to remind you and thank you for the fantastic campaign, the 1 Million in 1 Year campaign that was recently launched by the Canadian Nurses Foundation. And I hope most of you have heard about it, and if not, make sure you learn more about it. It is to support the education of Indigenous nurses, as well as research to improve health and well-being in Indigenous communities across Canada. So today, I encourage you perhaps to go online and make a contribution to the 1 Million in 1 Year campaign of the Canadian Nurses Foundation. We absolutely need to find ways to, as was mentioned earlier, of course, encourage many more young professionals, young people to consider a professional career in nursing. But in particular, you are a group of people who have a big role in trying to encourage Indigenous peoples in this country, young people, to consider joining nursing as a professional career. Our government is committed to supporting this effort. I know the Canadian Nurses Association very much is so as well. It is part of how we will honor the recommendations of the Truth and Reconciliation Commission to improve health and education of Indigenous peoples. I'm particularly proud within Health Canada of the Health Careers Bursary Program that provides support through the Inspire Foundation. And this is a program that has been promoted to increase Indigenous representation in the health system, and of course that includes nurses. But at the end of the day, bursaries and programs like this, as you know, may facilitate learning, make it possible for someone who might not otherwise be able to go. But it's the hard work of people like you, of people that I met and gave awards to in May, your professionalism, your compassion, your joy in your work that actually is what inspires young people, young Canadians of all backgrounds, to join the profession of nursing. So whether you contribute to this effort directly or by so many other ways that I know you're involved, by teaching courses, by mentoring students, by teaching at the bedside, or indirectly by setting an incredible example, you have a role to play by inspiring students and young health professionals to strive for a better healthcare system for all Canadians. You know as well as I do that Canadians are rightfully proud of our healthcare system. But you also know that there's plenty of room for improvement. And Minister Boudreau and I face those challenges every day, thinking of how we can improve the system. One of the areas that I wanted to touch on where I think that there are many challenges that lie ahead is an area that I've been thinking a lot about lately, and that's the matter of end-of-life care. I assume that many of you have been following along with me some of the work that we've been doing recently with Bill C-14, which I must say I am very pleased received royal assent just last Friday. This is an act that is going to affect us all. It is going to, as you may know, exempt certain healthcare providers, including nurses and nurse practitioners, from criminal code offenses when they participate in the provision of medical assistance in dying to Canadians to relieve suffering as patients approach the end of their life. I want to particularly thank the CNA for its incredible support, for the collaboration on this very sensitive and challenging issue, for being there on the other end of the phone when I had to call and say, what are we going to do now? And what do you think is the right move next? And how will we navigate these very sensitive waters? I thank you for your thoughtful contributions through the past few months as we have sought to find the best way forward. I have no doubt now, as we all turn towards the implementation of this act, that the CNA is going to be an invaluable partner, and I look forward to working with you in the coming months as we implement the act, as we study so many related issues. There are a few particularly challenging issues that we have made a commitment to study further, and we will welcome your thoughts on that, including matters like advanced directives for medical assistance in dying, mature minors, and requests for medical aid in dying for mental health reasons. The process of seeing this bill through the system has generated a complex but a very important conversation, not only about medical assistance in dying, but about end-of-life care in general. It has shed light on the fact that we have many shortcomings in terms of how we provide end-of-life care, including palliative care in this country. The national dialogue has been an example of why it's so important to have strong national organizations like yours, the Canadian Nursing Association, and I have depended upon you. We've been talking for many years about the challenges of our aging population, and I again want to compliment Minister Boudreau for a continued focus here in New Brunswick on aging, and I know many of your other provinces are also recognizing the tremendous challenges that we face with an aging population. Now, I always like to point out when we talk about this that aging is actually a good thing. It's far better than the alternative, and it's heartening to see that we get to now look forward to living relatively long lives, all else being well. But the healthcare system has not fully adjusted to this new demographic reality, and I know that it's hitting some parts of the country more than others. So an older population doesn't necessarily translate into a higher demand for general healthcare services, but it's going to lead to a proportionally higher need for end-of-life care and, in many cases, palliative care. But you know probably better than I do that so many Canadians lack access to high-quality palliative care. Give us a wave if you're a palliative care nurse in the room. There are a few of you there. Not as many as there should be. There are a few, so shout out to those of you who are there. But that perhaps demonstrates the reality. Apparently, according to statistics, 70% of Canadians can't access high-quality palliative care at the end of life, and that's particularly in rural and remote regions. Je ne suis pas certaine si nous, comme professionnels de la
As healthcare professionals have done a lot to explain end-of-life services, and especially palliative care. As nurses, you know that palliative care means more than just health care. It includes psychological needs, sociological needs, and others needs of the person. And you also know that palliative care is not necessarily only there for the dying person, but the members of the immediate family need assistance while they are living through this experience. That's why often we include care to those who are left behind, those who are mourning the loss of a loved one. We believe that palliative cares is the beginning of the end, and sometimes they lose hope. It's a lost opportunity for the patient and their loved ones. But instead of just explaining end-of-life care, we must speak to them. We must enter into a conversation. And with all Canadians, we must look at the possibilities. We know that today there are more people who die in hospitals than ever before. However, many people would prefer dying at home. As professionals, healthcare professionals, we are well placed to engage in this conversation. We must listen. We must be open to new ways of offering end-of-life care.
Canadians in their vision for end-of-life care has already begun for me and the federal government when we talk about home care in particular. And I hope that you have heard that our government has pledged, as part of a new health accord, to invest $3 billion to deliver more and better quality home care services, which will include palliative care. So it's not quite like your PhD announcement, but it's $3 billion. And since my appointment as Federal Minister of Health, I have had many conversations with my counterparts in the provinces and territories, and we are talking about how to transform not only home care, but palliative care and end-of-life care. We've supported a number of initiatives in order to build greater capacity for health care for this vital service. For instance, we've supported palliative care training for a range of healthcare workers on the front lines, but we need to do much more to advance awareness about care options, provider education, and research, and I believe that end-of-life care has to be one of our priorities going forward. In his excellent book, which you may have read, called Being Mortal, Dr. Atul Gawande writes that our most cruel failure in how we treat the sick and the aged is the failure to recognize that they have priorities beyond being merely safe and living longer, that the chance to shape one's story is essential in sustaining meaning in life, and that we have the opportunity to refashion our institutions and our culture and our conversations in the ways that transform the possibilities for the last chapters of everyone's life." End quote. We need to open up this dialogue in Canada and talk about how we can transform our own institutions and our culture, how we can better support Canadians in shaping their own story at the end of life. And nurses will be an essential voice in this conversation. I look forward to hearing your ideas on that. Our healthcare system is a defining statement of Canadian values. It's been a tremendous source of pride for more than half a century, but as I've noted, there is always room for improvement, not just in end-of-life care, not just in care for Indigenous communities, but in all areas of healthcare. I want to see a system, as I'm sure you do, where the patient leaves a hospital and seamlessly transitions to home and community care. I would like to see a system where mental wellness and mental health care are thoroughly integrated in the whole system and easily accessible. We talk a lot about the need for innovation in healthcare delivery, and perhaps the word innovation is an overused word, but it's really quite simple. It's about doing things differently, about overcoming challenges by looking at those challenges and thinking about them from a different perspective. It's about creativity, modernization, resourcefulness, and ingenuity, just the qualities that the people in this room hold. And as you know, Canada's healthcare system has many individual success stories and best practices, and probably you are part of some of those success stories. But at a recent speech in Ottawa, I quoted a tweet that I had seen come out of the Nova Scotia Medical Association AGM, and someone tweeted about the fact that Canada is innovation rich, but implementation poor. So here is our big challenge, folks. We need to take those great innovations and find a way to multiply and reproduce them in different contexts, adapting them as necessary across the country. Then we need to connect them into a patient-centered system and track the outcomes. One could look, for instance, at the partnership between the New Brunswick Association of Nursing Homes and the Canadian Foundation for Healthcare Improvement. Together, they are trying to improve care for patients with dementia. Specifically, they want to reduce the use of antipsychotic medications to treat aggressive behaviors. And last year, the use of antipsychotics was significantly reduced in more than half of the residents without an increase in aggressive behaviors. Falls by residents also declined by 20%. This partnership is now looking to reproduce, and I look forward to seeing the results as it's implemented across the country. As
I discussed with my colleagues from the provinces and the territories of new accords on health, especially this fall, we will like to hear from you. We want to know what you think as to how our healthcare system should be transformed. We have many priorities, including home-based care, pharmaceuticals, healthcare for the First Nations, better sharing of healthcare programs everywhere in Canada, and as well innovation in health. We know that to reach our goals, we need your experience. We need for you to be part of the process.
Nurses and the CNA as our partners in discussions around the Health Accord. We're eager to hear your ideas to improve everything from primary care to system integration. And I'm particularly encouraged by the steps you've already taken, including your partnership with the Canadian Home Care Association and the Canadian College of Family Physicians. I'll be interested in your findings as you look for ways to improve and coordinate services for those who want to stay in their homes as long as possible. So I would like to close here by thanking the CNA for its long-standing commitment to strengthening our healthcare system. I know the road hasn't necessarily been easy for years, in the last few years, for national associations in the healthcare space, but I want to assure you that our government is committed to a strong federal presence in healthcare. National associations like the CNA are going to be critical in the conversations that we must have about the future of our healthcare system. I want to thank all of you for participating here this morning and traveling from great distances to be here. And I want to congratulate the Nurses Association of New Brunswick for celebrating 100 years of dedicated service to this province. I'm told that the association buried a centennial time capsule last month as an act of hope. It presumes there will be future generations to learn from us. People we hope will build on our legacy. But a time capsule is also an act of humility. It's a message to the future that says, this is who we were, this is what we did in the time that we were given. I pledge to you that I will do my best in the time given to me as minister to work with you and our many other partners in healthcare to strengthen the healthcare system that we all believe in, so that when that capsule is opened, future generations will look back on us and our time here and be proud of what we accomplished on their behalf. Thank you. Merci beaucoup.